Bismillahirrahmanirrahim. Assalamu alaikum viewers and parents. Dr.S.M.Zafeer with you, and you are watching my YouTube channel. Today I will share with you a very important topic which has been rarely discussed with the parents. Do you aware about masturbation below 2 years of age? That is infantile masturbation. I am sure you are completely surprised. Yes, because no one has talked to you about masturbation in infant and young children. First of all, let me tell you that occasional mothers used to complain that her 1-year-old child used to put his hand under his pant and keep holding his genitalia very often. Secondly, you must have noticed that as soon as you open his diaper, he grabs his genitalia. Why the very young children used to grab or play with their genitalia? Firstly, they feel pleasure, and secondly, they are identifying and experiencing their body part. Now, let me share about this behavior. Viewers and parents, I will not talk about masturbation in teenage or adults. I will only focus masturbation in infancy and early childhood and what to do. Gratification disorder, also known infantile masturbation. Now, what is infantile self-gratification? It is a form of masturbatory behavior occurring in children as old as 10 months of age. The concept of infantile masturbation was suggested in the early part of 20th century. Infantile masturbation usually starts by 2 months of age, although in utero cases of masturbation have been reported. This masturbatory behavior is often mistaken for epilepsy, abdominal pain, and so on. Because this behavior presents with body and lips movement, grunting and sweating, children tend to get fatigued after the episode and fall asleep. Why do toddlers self-stimulate? It is generally believed that the behaviors are repeated because they offer the child gratifying sensory input. Masturbation or self-stimulation of genitalia is a common human behavior and is believed to occur in 90 to 94% of males and 50 to 60% of females at some point during their lifetime. It has variable clinical presentations in early childhood. That's why it is often mistaken for epilepsy. Other than grabbing his private part, he may rub with the sofa handle, tricycle seat, and the girl sometimes puts her toys under the garment. Little research has been published regarding early childhood masturbation. However, most pediatricians agree that masturbation is normal and common behavior in preteens. Failure to recognize this behavior can lead to unnecessary and invasive testing. Infants and children with these very stereotypic behaviors sent to the pediatrician from the primary care physicians to rule out seizures or occasionally as movement disorders. The most important aspect of diagnosis is often reviewing videotapes made by the parents at home which illustrate the behaviors. This behavior may be confused with seizure or convulsion. The key to diagnosis is it stops if you distract him and consciousness remain intact during an episode, and this suggests that this is not seizure. The behavior tends to diminish with age. Many referred patients have been through a series of unnecessary diagnostic tests, including electroencephalogram and neuroimaging. The clinical history reviewing the video clip of the episode, and no loss of consciousness is diagnostic of infantile masturbation or self-gratification disorder. A careful history from the mother and simple act of taking a home video recording during the episode with a mobile phone camera can be very helpful in establishing the diagnosis. As this is a normal human behavior, it needs nothing more than reassurance to the anxious parents. It is highly preferable to use the term gratification disorder instead of infantile masturbation in view of social stigma attached to this term and to alleviate parental anxiety. Now, mother usually asks, how do I stop my baby grabbing his genitalia or private part or from masturbating? If your toddler is too young to understand the concept of privacy, distract him when they begin to grab genitalia in public. Send him to set up a game such as a jigsaw puzzle to complete. If your toddler is doing this in the privacy of your home, and if at all possible, simply ignore it. Never tell your child that the genitals is a bad part of his body. When a family physicians recognize this phenomena, parents can be promptly reassured and children can be spared unnecessary and sometimes invasive investigations. Now the other question the mother asks, how long does gratification disorder last? Gratification phenomena in infants are benign and self-limited. It is spontaneously disappearing by 2 years of age. How is gratification syndrome treated? Treatment usually involves counseling and educating the parents. Although it is called disorder, but it is a normal behavior in children and that they will often outgrow it. So let's talk about the take-home message for this phenomenon. Number one, gratification syndrome is a normal human behavior. Number two, it starts as early as 10 months of age and diminish by 2 years. Number three, if he or she is doing in front of public, just distract him. Number four, if he is doing at home, just ignore him. Number five, if you want to consult the doctor, always bring the video clip of the episode to avoid unnecessary invasive investigations. Number six, careful history from the mother. Reviewing the video of the episode are enough to reach the diagnosis. Number seven, treatment is only reassurance the parents about the benign and self-limiting condition. Number eight, don't use the term masturbation because of social stigma. Number nine, better to use the term self-gratification. Thank you very much. Stay blessed.